Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Abdullah Abdul Mumin, and I'm here to perform an NG tube insertion for you. Can I have your name and age, please? All right. The procedure is I'm going to insert a feeding tube into your stomach, and it would go through your nose and to your stomach. The procedure is uncomfortable, but I will try my best to make it as comfortable as possible. You have to make sure that the patient has no contraindications. For example, like facial fractures or facial trauma, airway obstruction, esophagus obstruction, or deviated septum. And if he has deviated septum, choose the nostril, which is most patent. Then you can begin. First of all, you need to have the equipment needed. You would need, of course, the NG tube itself. You would need the adhesive tape, emesis basin in case the patient vomits, 60 ml syringe for aspirating the abdomen and pushing air into the tube, suction tube, lubricant for lubricating and facilitating the entrance of the NG tube, a drape for covering the patient, and gloves for wearing on your hands. After washing my hands and wearing the gloves, you'll now begin the procedure. First of all, get the drape and put it on the patient. Then you measure the expected length to the abdomen. And to do that, you put the tip on the bridge of the nose, tip of the nose, and move it to one of the earlobes. And from the earlobes, you move it to the xiphoid process. This is the expected end. And just to mark it, we put tape on the expected end. All right. Next is the insertion of the NG tube itself. First of all, you have to coil the NG tube to make it easier to enter. Just coil it around your finger like so. Okay. And then you dip the NG tube into the lubricant. Just dip it fully. Remove it. And begin the procedure. Tell the patient that you will begin inserting the NG tube and insert it slowly. All right. Once it's inside the nasopharynx, the patient will gag as an indication. Then you ask the patient to take a sip of water. Can you please take a sip of water and hold it in? Don't swallow it. Okay? Until I tell you to. Bend the NG tube 180 degrees so that the bend is at the hits the posterior wall of the esophagus and it goes smoothly down to the abdomen. Ask the patient to swallow it now. Can you please swallow it? Ask him to flex and push it in as he is swallowing. Push it in. Until it reaches the point that you have appointed. Here. Okay, now you have to secure the nasogastric tube on the patient. To do so, get a piece of tape, a long one. Just put it like this, and then stick it on the patient like this. All right. Now you need to make sure that the the nasogastric tube is actually in the abdomen. And to do so, there are several tests. But for this purpose, we're going to use the syringe whoosh test. And you need a stethoscope for this. First of all, put on your stethoscope. Insert the syringe full air first, 30 milliliter. Insert the syringe onto the tube itself. Put the stethoscope on top of the xiphoid process. And then push or propel air fast. You'll hear a whoosh sound come through your stethoscope. That indicates that the tube is inside the abdomen. Other methods for testing are pH test. You aspirate a fluid and then put it on a litmus paper for pH. And the other method is X-ray, which is the golden standard. It's the most accurate, and use it when you're in doubt. The next step is inserting the nasogastric tube to the suction tube. To do so, grab the suction tube and insert this end to the white end of the nasogastric tube, which is the feeding end. And that's it. Just put it on the side. Now, the final step is removing the nasogastric tube. To remove the nasogastric tube, you need to do the 20-20 rule, which is grab 20 milliliters of water from the syringe, or you can use normal saline. Now we have 20 milliliters of water. Then get 20 milliliters of air, like this, 20 milliliters of air. All right, then insert it into the nasogastric tube slowly. Okay. Now you can remove the nasogastric tube. You remove it slowly so that the content doesn't spill on the patient. Just remove it slowly. And then throw the nasogastric tube into the canister. And that's it for the exam. Thank the patient, help him get cleaned, and that's all.